Hey guys, welcome back to my channel. If you're new here, welcome. My name is Amanda. Today we're going to be doing my 30-week pregnancy update. I am currently, as of today, 30 weeks pregnant with baby number 2 that we conceived via IVF. So we are super excited. I cannot believe that we are, I think, exactly 70 days away from potentially meeting this baby. I had my first baby at 39 weeks and 1 day, so technically that would put us like 64 days, but we're gonna say 70 just to hopefully be mentally prepared for it. I also know that sometimes in IVF pregnancy, some women get induced around 37 weeks, so that is something that I've had in the back of my mind, but we're gonna be starting NSTs and weekly appointments, I think at my next appointment, so or every other week appointment. I don't know exactly the timing of it, but I have an appointment scheduled for February 6th, which is my 36-week appointment, and it's a growth scan, and then just like a routine appointment with my doctor. So, well, not my doctor, but a doctor. I've seen now, this is like the 3rd different doctor I've seen in this practice, so I think I see them all. So whoever's on call, I know, maybe, I don't really know, but hopefully baby is growing as they should and we have no problems and we can keep progressing in our pregnancy super easily, because so far we've had a really easy pregnancy. First and foremost, I want to talk about my last growth scan, which was at 24 weeks, and I have it pulled up here, 24 weeks exactly, I think, and baby was measuring at 24 weeks 2 days 54 percentile. Their head circumference was measuring at 23 weeks 5 days in the 22 percentile, and then their abdominal was measuring at 25 weeks 3 days at 83 percentile, like in the 83 percentile. And then their femur length, which is the 3rd measurement they usually do, was measuring at 23 weeks 3 days in the 19th percentile. I'm super used to seeing like lower percentages because with my first, she also was just always in the low percentiles. Like we were on the verge of being diagnosed with IUGR, so that doesn't really intimidate me or scare me, but I am going back for a growth scan at 32 weeks, so hopefully we get updated numbers by then. Okay, I'm looking at my notes. I also am fighting off like the last little bit of a cold, so if I sound stuffy, that's why. So in my notes, I still have that I have tons of gagging. Like still things make me gag randomly. Some days are like worse than others. Some days I'm just gagging normally. Sometimes when I talk about it, like now, and then other times like I'm just triggered by certain things. So I'm still gagging, but no throwing up. I'm fighting the urge to gag right now because I'm talking about it. I'm starting to pee a lot, and it's getting to the point where like I don't have to pee, and then within like half a millisecond I have to pee so bad I want to pee my pants. So that's been really fun. I don't remember having that with my daughter. I have been waking up multiple times throughout the night to pee, which I did that with my daughter too, so that's nothing new, and that's pretty common in pregnancy too. I wrote that it's uncomfortable to sleep and that I had no insomnia, and then literally for the next 2 days I had insomnia where I was just tossing and turning and I could not fall asleep for the life of me. But thank goodness last night I was able to sleep basically through the night. I think I woke up 1 time, but nothing like the last 2 nights. So I'm still gonna say I have no insomnia because I'm gonna be hopeful, but so far just the normal like pregnancy uncomfortableness, like flipping from your sides, and you know, you want to sleep on your belly or your back and then it hurts and it pulls and it tugs and pushes on things, and so just trying to find comfortable sleeping positions, but for the most part I'm uncomfortable when I sleep. Okay, the next thing is that I've had a high pulse my entire pregnancy, around 110 to 120. So I was referred to cardiology and I wore a heart monitor for what was supposed to be 2 weeks, but it ended up being like 11 days and some hours that I actually wore it because I had a severe reaction to it on my skin. But it came back normal, like my rhythm was normal. I had a higher rate than normal, but I had like a normal rhythm. So according to the report, there was nothing major to report. I do have an echo and a follow-up with my doctor, I think in March, which is like forever away, I feel like. And then he said, since my due date is in April, he'll keep me until after I give birth, and we'll do additional testing afterwards just to confirm that it's pregnancy. But to be honest with you, I've had a high heart rate most of my life. And this isn't the first time that it's been brought to my attention that I have it. I have a friend who's in nursing, and at one point she would open my watch and be like, girl, your heart rate is so high for just sitting down. And I'm like, oh well, like this is always how it's been. So I think I've just always had it. I don't have any symptoms of it. I don't feel, sometimes I feel my heart in my chest, but for the most part I don't feel shortness of breath. I don't feel tired. I don't feel palpitations, no pain in my chest. I don't feel any of those things. So those are all good signs that it's just high heart rate. But that same nurse friend has said that I should consider talking to my doctor about taking medicine to slow my heart rate down. So I may talk to them about that depending on what they say at my next appointment and what they already suggest for me to do. So that's been fun to deal with. A little bit scary because my dad passed away from a heart attack, his first and only heart attack. And he was only 52 at the time. He would have been 53 that year. So he was very young. He's considered very, very young to pass away from a heart condition. So it's always been on my doctor's radars as far as heart issues and stuff like that. So I'm excited to get the echo done to see if maybe it's something that's abnormal, or if it's just that I have a high heart rate and that's just what's normal for me, and we have to kind of just help it bring it down a little bit. But like I said, it's never, I think my low, oh, I have like, I literally can pull up the report here because I pulled up the report from my last growth scan. My minimum heart rate was 65 with a maximum heart rate of 164. All these rhythms were in a sinus mechanism, no significant arrhythmia, and no bradycardia or pauses were present. In summary, this is an unremarkable event monitor. So that's basically what they said. I'm glad I got it done, but there was no diagnosis done, just that I'm okay. Like, I don't know what else to say other than, you know, I just have a high heart rate. I wish it would have said my average, because that would have been nice to know. It just says minimum and maximum, which honestly a maximum heart rate of 164 is kind of not bad at all. I mean, I don't do like cardio or anything like that, so that's probably why. But being pregnant at all and chasing a toddler, you think my heart rate would get a little bit higher than that, but not bad, not bad. Okay, another thing is that I have had high amounts of ketones in my urine every single doctor's appointment. And the first doctor's appointment, she was like, I'm not worried about it, it's probably just the beginning of pregnancy. Then I go back to my second appointment, the amount of ketones increased, and so she talked to me about it and was like, you know, let's just make sure that we're eating till we're full, and if you even, you know, want to have like a protein bar throughout the day, or just something small to kind of, let me like move you guys, like maybe I'm not having that shot on my face. My house is a mess because I just moved in this house, so you guys are gonna have to excuse that. What was that? But what was I talking about? Oh, so she was like, you know, let's just try to eat more food throughout the day, even if it's small meals, even if you're just grabbing a couple chips or whatever, a couple grapes, a couple, you know, just anything, and let's see what happens at your next appointment. I said, cool. I go to my next appointment and my ketones were even higher. So that time she was asking like why I was still in ketosis and why I had ketones in my urine, and I explained like I try to eat as much as I can, but one, food, it just grosses me out. Like, I don't have like a desire to eat food. Like, it's just an aversion to eating. And then when I eat, I feel like I take like 4 or 5 bites and then like I'm done. Like, I'm tapped out. I'm just like, I'm full. Like, I'm so full. It's uncomfortable full. So I just, it wasn't, like it wasn't that great. And so then I started to get really conscious about it because I didn't want it to affect my baby's growth. And so I started weighing myself pretty consistently, almost every single morning, same time every morning. I tried to do it, you know, with no clothes on. So I got a super accurate reading. And as of right now, I am under my pre-pregnancy weight, which is kind of weird to be in that position, because with my daughter, by this time I had already gained like 25 or 30 pounds or something like that. So this time around is a little bit different with it, but I'm just trying to remain positive that baby is still growing as they should, which is why another reason I'm getting a growth scan. I'm getting a growth scan because it's an IVF pregnancy, and that's what MFM referred me to, or recommended me to do. But I'm also getting it done because I did have that concern of like, is it affecting my baby's growth? If you don't know what ketosis is, my understanding of it, and I'll put like a definition down here so you guys can have like a more accurate definition if mine is off a little bit, is when your body is lacking carbohydrates mostly, and so it starts to use stored fat as energy, and that puts your body into ketosis, and it releases ketones. And so then you're starting to use your stored body fat as energy, because carbs are your main source of energy in the body. So when you're not doing that, your body has to kind of go fight and flight mode. So she was like, not necessarily, you know, I wasn't super overweight when I got pregnant. I was, you know, heavier than I've ever been in my life, but I wasn't like, you know, categorized as overweight or anything like that. So she was like, is it a bad thing? Not necessarily. Is it something for us to watch for? Absolutely, because we definitely don't want it to affect baby's growth. But she did say like, your baby is going to take every ounce of nutrients first, and then your body will take it, and then like your vital organs will take it basically, and then, you know, that's the process, I'm assuming. I don't really know like how your body breaks down using energy, but she did let me know like that your body is going to give your baby the energy first when you're pregnant. That's just kind of the nature of things. So that's nice. I did pass my glucose test. I actually passed it, I think you have to get like a 135, and I got a 112 on my glucose test. I'm literally looking at the results right here. I have like all my test results in one convenient place. So that has been nice. I also did have the baby's echo done on them a while ago, and that was all normal. That actually came from the numbers that I just showed you guys. It was an echo, and then I guess they just decided to do like a little growth on them to see what their growth was. So that's done, and that was cleared. We're checked off on that, so that's good. I also have talked about their kidneys, because if you didn't know, or if this is your first video or whatever, my daughter was born with a couple of kidney abnormalities, and she ended up getting sick with a UTI. She went septic and then got meningitis. That's like the order. It went from her urine to her blood to her spinal fluid when she was only 3 weeks old. So that is on my radar. We have talked about, or I've talked about with the nurse about getting an ultrasound done before we get discharged from the hospital. And then when I talked to the doctor about it, she was like, I don't know, because you'll need doctor's orders for that, and I don't know if the pediatricians like on call for the day will be comfortable doing that without knowing like the full extent of their history, or of their sister's history. But then the doctor told me that what I could do is take my daughter in to see a pediatrician, and also, you know, talk about this baby and see if they could do it, if they could put in the referral like the second that baby is born, and then they can do it while we're in the hospital. So that's an option too. So I don't know exactly what's going to happen, because she also said like the pediatrician could just, you know, you go to your next pediatrician appointment when you're discharged like within the next few days, if not the next day, like within the next few days, and they can just put in the work order. You can tell because I just moved that I've been putting in work orders, but they can put in the referral and they can expedite it. So we would know within like their first week of life if they had the same abnormalities that my daughter has. My daughter ended up getting surgery at 2 years old, and she was also on prophylactic antibiotics from the moment we came out of the hospital until I think 6 months after her surgery. And so she was taking antibiotics every single day, and she got a UTI religiously every 3 months from when she got sick. When we got discharged, she got one every 3 months, and every 3 months we were in the ER, because if we went to urgent care, they would be like, nope, not touching you, straight to the ER. If we went to the pediatrician's office, almost 9 times out of 10, our pediatrician would be like, just go to the ER, see your urologist, let them take care of it, because it's a long ongoing issue. And though I know to give you antibiotics, it's best if we just have the urologist take care of it. So that's kind of the plan for this baby's kidneys. But that's basically all I have as far as pregnancy updates. It's been going really well so far. I don't really have any complaints. I've had very minimal Braxton Hicks. I don't really feel uncomfortable most of the time. Like, I don't feel comfortable in my hips. I don't feel pressure in my pelvic bone yet or anything like that. So I feel like we're just moving and grooving. I feel like with having a toddler, it's just, I don't know. I don't know if it's made like pregnancy easier on my body, or maybe it's because I haven't gained weight with pregnancy. I don't know what it is, but I just feel like my pregnancy is pretty smooth sailing. I am back on my anti-anxiety, antidepressants, which I got off for a while. And then when I talked to my doctor about it, she goes, it sounds like you should get back on it. The pros of being on it outweigh the cons of being on it. So I am back on that, just at a lower dose. And then after birth will put me back at my normal dose that I've been taking for years now. That is basically it. I hope you guys enjoyed. Oh, let me show you guys my bump real quick, because you guys really haven't seen it unless you're watching my vlogs. Let's see. I feel like I need to put you guys down a little bit. Okay, so here is with pants on, and then I'll take my hands off so you guys can see the front. Sweet baby. And this side. So that is that. And this is what it looks like with clothes on. Hold on, let me pull my pants back up. And here's what it looks like with clothes on. I feel like it looks the biggest when I have like clothes like this on. Like just like a t-shirt. My bras. I wear really bad bras, guys. I hate bras, but I feel like I look super pregnant when I wear shirts like this. But yeah, 30 weeks. But that is it for this video. I hope you guys enjoyed, and I will see you guys at my next update video, which I'm gonna do at 34 weeks. So I will see you guys in a month, and hopefully we have a little bit more knowledge on baby's growth, my heart rate, maybe not my heart rate because that's in March and this will be in February, and ketosis, but and hopefully we start doing NSTs, so we'll know if we are at risk for being induced early or if we're good to go, because my idea is to not be induced at all. It is pretty controversial. Some people and some doctors believe like all IVF pregnancies should be induced. This doctor, this practice, they were like, we don't really say yes or no. We just monitor baby and mom, and we make the call as we go. Like, we're not gonna say like, yes, be prepared to be induced, because if baby's growing fine, baby's not stressed, mommy's fine, no signs of preeclampsia, no signs of baby in distress, like, we're gonna let you be pregnant as long as you want to. Like, some women feel comfortable going to 42 weeks and some women don't feel comfortable going past 40 is what I mean by want to. But I will get induced definitely before 41 weeks. I've watched some really horrendous videos about babies that go after 41 weeks, so I'm kind of like fear-mongled into that, the same way I was fear-mongled into getting off of my antidepressants for pregnancy. But I feel like for me, 41 weeks would be like the cutoff where I'd be like, okay, time to get this baby out of me because I'm tired and I don't want anything to happen to them, so let's do this. But anyways, I hope you guys enjoyed, and we'll see you guys for our next update in 4 weeks. Bye, guys.
So I just close my